Hello, and welcome to the December edition of the Tinley Chamber Spotlight Show. My name's Maureen Cipolla, and I'm delighted to be your host. For those of you that are viewing us for the first time, the Chamber Spotlight comes to you each and every month, and we have 3 different Chamber business members on, and they get to share their story about their business. Thank you for viewing. So let's get our show started. I have a great program ahead for you, and my first guest comes to us right from downtown Tinley Park, Omar Hassad from Tinley Apothecary. Omar, welcome to the show.
Thanks for having me, Maureen, again. Thank
Yes,
you so much.
great to have you back. How long has
Thanks.
it been?
Almost 2 years now.
Oh,
it was
my
2 years ago.
Goodness, and you had just opened up,
We
that's
just
right?
opened up, correct. Yeah,
Oh.
yeah, we're knocking on 2 years, and growing, thank God.
Congratulations.
Thank
I
you
know
so much.
usually the first year or two, from what I understand, is most challenging when you're just getting started.
For sure, it is the hardest. The first 2-3 years is the hardest for any business starting up. So the build-up process takes time, and you have to have a lot of patience. And you have to do your homework, do your due diligence, make sure as far as the marketing, what you have, the business plan executed, so all this, the financial parts of it, you gotta have all your ducks in a row.
Wonderful. Well, for our viewers that are meeting you for the first time on the air here, tell us a little bit about apothecary. Let's talk about the meaning of it.
Yeah, sure, of course. Apothecary is an old term. A lot of people who come from Europe are very familiar with it, especially from England, the British people, Irish people, they're very familiar with it. It means a drugstore, a pharmacy. And it's in modern day is not used often, but it fits where we located in Tinley. It's the old Tinley, so we use the word apothecary. And it's unique. And when you use a unique term like apothecary, it sticks with people and they tend to remember it. So if you go to your doctor, say, send my prescription to the apothecary, there's only one apothecary, so they can't miss it. It's very hard when you say Joe's Pharmacy, what have you, there might be 2 Joes, what have you, but apothecary, there's only one. So it's easy for them to say Tinley Park Apothecary, and they could find it that way.
Excellent, Omar. So tell us a little bit about, independent pharmacy, is that right?
Yeah, independent pharmacy, so it's true independent pharmacy.
Some benefits then.
Oh, there's huge benefits for using independent pharmacy over the big chain, the big box. For one is the service, the level of service you're going to get it from an independent pharmacy. It is extremely better than what you get from the big box. There's one-on-one service. We will know who you are. We will know your name. We will know everything about you. We will even know your dog name, so because we socialize with you. We try to get to know you on a personal level. Unlike in the big box, you're just a number. They barely know you. The staff change. Everything is based on number. They play the number game. How much profit we're making? We made profit, we give our staffing. We don't make profit, we cut staff. That is not how it works at Tinley Park Apothecary. You are not a number. You are a person that we care for your health care needs, and we truly care for your health matters, and we're going to always go above and beyond for you. And that's what sets us aside for independent pharmacy. We deliver a lot of services. We deliver, our delivery service is free for all our local Tinley, Mokina, Orland Park, within 10-mile radius, and we even ship anywhere in the state of Illinois. And beside the personal level, when you dial, you get us within the 2nd or 3rd ring. You're not on hold. There's no music, and when your doctor sends you a prescription, it's done within minutes, not within hours or days sometimes. So there's a huge benefit for using independent pharmacy.
That's great. So tell us a little bit about, you started about 2 years ago, and really, what does it do for our local economy here and our local citizens and the businesses here in downtown Tinley?
Well, as small business are the backbone of the economy. We have our big corporate companies. They're there. Their number one is they're there for their shareholders. There's what have you. When it comes to the small business like Tinley Park Apothecary, the bottom line, if you support your local business, you're actually supporting yourself as a citizen of Tinley Park, because that drives the economy. That means if we get busier, that means we're going to hire people. We're going to hire local because we want people that know that's this person working for us is a local person. Actually, we already hired a pharmacist that worked local for us. He lives within minutes from the pharmacy.
That's excellent.
And it makes a huge difference. So yeah, supporting your local business, ultimately you're supporting yourself as a citizen of Tinley Park. Right.
Well, give us a little bit about, tell us about your background again, Omar.
Well, I was born here, in Chicago. I was born in Oak Lawn at Christ Hospital in 1974. My dad passed away when I was 3 years old, so I had to go back overseas. So I grew up overseas, but I came back after I finished high school in Jordan, in Amman. So then I came back here, and I was a pre-med student, but I changed my mind. It was tough, hard times. Financially it was hard for me to go to med school, so I decided to go to pharmacy school. So I did, and what a good choice. I'm glad I did, because I'm still serving the community. It's just in a different aspect. So I'm very happy that I got the chance to become a pharmacist. So where you could make a difference in people's health.
Right. No, that's excellent. And you had touched on some of the personal attention that you provide, and you had talked a little bit about delivery. And tell us how that works. So is there a specific geographic area? Is there a cost for it?
There is no cost for delivery. It is free, absolutely free. And and nothing better than actually when a mother with a sick child stuck in a drive-through at a big box forever trying to get her child's medication, or a sick elder lady with a pneumonia that can't get out of the house and have no way of getting somebody to get her medicine. That's what that delivery is there for. It is free. We offer it to all the citizens, with Tinley, Mokina, Oak Forest, within 10-mile radius. So take advantage of it. If you need the service truly, it is there for you. So I want to make sure you take advantage of that service. And if you have a loved one that lives far, we ship. We use the United States Postal Office. We ship like second day or third day with the gets there. And one of the benefits with us in Tinley Park Apothecary, like I said, we do not treat you as a number. It breaks my heart, Maureen. I'll give you a simple story. I have a lady, she's a nurse. Her daughter's bipolar. So she went to the big box with her insurance. They wanted $690 for a 1 month supply prescription. So she called us. She ended up buying it from the big box. She paid $690 for that medication. And she called me, she said, the only reason she knew about us because her cousin told us about us. So she called, she said, how much do you charge for this? So I told her it was $60. She was confused. She said, that doesn't sound right. No, it does sound right. What the problem is, she has a high deductible insurance. She's never ever gonna meet that deductible. She's only on one prescription.
Sure.
So my cost is less than 60, but at the big box, they don't do that personal touch. They don't go above and beyond to explain to the lady, you have the right. If you want it, within our program, in-house program, I could give it to you for $60. Then now she's a customer for life, and she's very happy that we went above and beyond to explain to her. And our elder citizens with Medicare, they are so confused for the plans every year. When open enrollment come, they need that one-on-one touch. Somebody sit down and explain their options and tell them, okay, these are the plans, this is your options, you think about it, this is what your deductible, this is what your gap, the donut hole, they call it the gap, So we explain to them that one-on-one personal touch, it makes a huge difference.
That's a great story, and it's really a testament to that one-on-one personal attention that you're sharing.
Absolutely.
What does the future look like for the pharmacy?
Actually, it does. It looks very bright. It's unfortunate if you look on the there's bright and it's not. I'll tell you why it is both ways. It's bright because I see that the baby boomers are growing, getting older. So they're going to need somebody who care for them. That's the good part, that we're going to be there to provide that care for them. The unfortunate part for us as an independent pharmacy is the dealing with the insurance company. It's becoming tougher and tougher for independent pharmacy to survive. And as you've seen our local community, you guys all experienced it, a lot of pharmacy had closed down or got bought out by the big box. It is hard to survive. So that is the part, the insurance company, they put a tight squeeze on the independent pharmacy. For every one independent pharmacy opens, 5 closes. And that rate, independent pharmacy is just going to diminish. So we want to make sure that we are doing better. We are going to survive. So make sure you support us in that sense. So that is the future of pharmacy. It's driven by clinical services, and the retail part of it. So we're trying to combine both. So
that's great, Omar. Wow, I can't believe we're almost out of time already. Yeah. It's been such a thrill to have you back on and catch up with you. I'd like to welcome our next guest, Bob Feldman, the owner of Nothing Bundt Cakes in Orland Park. Bob, welcome back to the show.
Thanks for having us back. We absolutely love to be here. So
I am just savoring everything in front of me here and smelling the delicious cakes. But for our viewers, Nothing Bundt Cakes, Bob comes to us. He opened about 3 years ago now.
Yep, in September of 2014. So
that's excellent. Congratulations.
Thank you.
We know you're a franchise, so let's talk about how many locations are out there.
We have now 228 open locations across the United States. So it's a growing franchise. which is absolutely fantastic. We're up to 13 locations across the Chicagoland area, and we continue to add more.
Wow, that's amazing. So, you were on about a year, 2 years ago, and how many, how fast, what's the rate that they're opening up here in the Chicagoland area?
Well, we've been opening stores here for the last 4 years,
Okay.
and now we're up to 13 stores. We just opened up one in Rockford as well, and my wife and I, we're getting ready to open up our second store in Mokina. And what's great about this franchise is each location is an individual buntique, meaning that they each bake their own cakes that you purchase and buy at that location. So everything that's purchased at our locations is freshly made right there on site.
I love it. I love it. So for someone that may not know, it should be hard not to pass or stop in one of those. Let's talk about, that's first of all important. So it's not something that gets shipped and it's frozen.
Right.
So what does the start time to the workday look like for you?
Well, our bakers get in as early as 5 a.m. in the morning to start baking up our batches for the day. And then our crafting and our greeting team, and we're open every day during the week until 7 p.m. out of our Orland store. So our bakers are there the entire time to make sure that we have plenty of product for all the guests that come in and want our delicious treats.
Oh my gosh. Well, they certainly are delicious. I can tell you that I am a big fan, as you know.
Yeah.
Let's talk about, we're in the midst of the holiday season here, and these beautiful cakes that we have in front of us. If you want to tell us a little bit about each one. I know there's different sizes and versions here.
Yeah, we have 4 different sizes of cakes. This right here is our Buntini. These are fantastic for parties, corporate holiday events, just giving. They come and are sold by the dozen. You can get them decorated or undecorated, and you can get them in our top 4 flavors, which is lemon, chocolate, red velvet, and white chocolate raspberry. And you get a nice mixture, 3 of each, and it's just a great way to give something and share that dessert. The next thing is our buntlet, our individual buntlets, and they come in 1, 2, or 3 high towers.
Okay, and I see
And
the
so-
3 here.
Yeah, the
okay.
3 high towers. And for under $20, you can get a 3 high tower. The 2 high tower goes for just over $12, and this is under $10.
Nice.
So these are great gifts to give to someone that you care about, or someone that you like to get a nice fresh baked gift to. I think they make great gifts. And then we also have our holiday decorated cakes. I brought with me our brand new Merry and Bright decoration, which I absolutely love. It's
Oh, that's
featured on
pretty.
our 8-inch red velvet cake. And these are this is under $32, and our big 10-inch cake serves 18 to 20, and that's $42, and that's our Christmas Holly Jolly cake.
Beautiful, beautiful. So we are in the midst of the holidays. So let's talk about, can you ship?
We do. We can ship all around the United States. We may refer you to another location around the U.S. that's maybe closer to where you want to ship it to save you a little bit of money. But certainly Nothing Bundt Cakes can handle shipping needs across the United States. And we even have a location in Canada too now.
Oh, no
So,
kidding.
yeah.
Okay, nice. So let's talk about, can someone walk in and just purchase a cake, or do you recommend, especially for holiday season, calling ahead? Do you have any?
We definitely recommend calling ahead. Since we make a fresh baked product, you can only bake so much in a 24-hour period. So pre-ordering your cake ensures that you're going to get exactly what you wanted to get. Walking in, we always make inventory for folks that maybe didn't plan or something came up last minute. And we certainly want to help you with your needs as well. But if you do kind of know what you're going to be doing, I would definitely recommend at least 1 or 2 weeks in advance to call in and place your order.
Especially, with all of the parties and
Yeah.
the big orders, I can imagine that you're filling, and that's important because, freshness, I love it. I know you guys helped me out in a pinch one day where
Absolutely.
I had a last minute run through, and again, you saved the day for me, so that was great, and I certainly can attest to all these flavors. So let's talk about flavors. Are there seasonal flavors going on right now?
You know what? The flavor of the month for the month of December is a peppermint chocolate chip.
Oh.
And it is absolutely delicious.
Yummy.
We take fresh peppermint and we put it in our #1 selling cake, our chocolate chip cake. and it is absolutely delicious. And you can get that flavor in any of our sizes of cakes.
Oh,
So,
nice.
Yeah,
Oh, that's nice.
Exactly.
So there are some seasonal changes, if you will, and flavors that,
coming
that
up
change up.
every month or two we change our flavors. In January we do a chocolate turtle.
Oh, nice.
It's our chocolate cake with caramel drizzle and chopacans in it. It's one of our fan favorites.
Oh, well, I'll look forward to that as well. So, really, the business plan, it sounds like it's just thriving, and you're going to be opening up, you mentioned, in Mokina as well.
Exactly.
Let's talk about that. What kind of time frame do you have in store for that?
We hope to be open by next fall. So
Okay.
before the next holiday season, a lot of the community between Frankfurt, Mokina, New Lenox ask us quite frequently, when are we
Right.
going to open? When are we going to open? And they come to our store in Orland. And we hope to have that open in the September timeframe. It's a brand new building, so
Sure.
it's somewhat out of our control a little bit, but we really hope to be open as soon as we can.
That's excellent. Well,
Yeah.
congratulations on that.
Thank you.
What does the staffing look like now here in your Orland facility?
Yeah.
How many team members do you have?
Where our Orland store is the largest store in the country.
Oh my goodness.
Yeah, out of all the stores, there's only 2 stores in Texas. They are a little bit larger, but outside of Texas, we're the largest store. We have 47 employees.
Oh, congratulations.
We continue to grow double digits year after year, especially now that the construction on LaGrange is all cleaned up. It has helped our business tremendously. So we just, continue to get great support from the community.
Okay, well, that's great, and nice to hear that you're growing and there's jobs that you're filling there too. I know your lovely wife couldn't be with us, who's a co-owner with you.
Exactly.
For our audience here, what kind of plans? I know there's going to be a lot of juggling with the new facility coming. Are you going to kind of split and handle both of them, or are you going to bring on some management team members too?
We definitely we have management currently in place
Yes.
at our Orland store. My wife, she really does a phenomenal job handling the operations of our store.
Perfect.
She ensures that all of our guests get the products that they ordered, and we have enough products. And my role is on the marketing and advertising, doing events for the community, and helping out with our front of the house staffing.
Perfect.
But and so we're just going to continue with the same model. She's going to continue to handle the operations for both stores, and she'll have a support team underneath her to support her with that.
Wonderful, and I know you're both very involved in the community.
Very involved.
We thank you for being part of the Chamber of Commerce, and believe it or
Thank
not,
you.
Bob, we just have about 45 seconds left
Oh,
of
wow.
our interview here, so we wish you a very prosperous season, and thank you for being part of the Chamber of Commerce. And if you have a parting message for our audience, we wish you the best.
Well, on behalf of Nothing Bundt Cakes in Orland Park, we want to wish everyone in Tinley and surrounding communities happy holidays. We hope that you come and support us, and we hope that our bundt cakes are part of your holiday celebrations. Thank you for having us.
Terrific. And to find out more about Nothing Bundt Cakes, you can reach the Chamber office at tinleychamber.org or call us at 708-532-5700. I'd like to welcome our last guest, who is no stranger to the Chamber of Commerce, Kelly Burke from Insurance Counts, and Kelly is also our treasurer at the Chamber of Commerce. Kelly, welcome back to the show.
Yes, thank you for having me.
Oh, my pleasure. Well, it's that time of year again, Kel. I can't believe it, and we are talking about open enrollment for insurance.
Yes.
For our viewers that are just tuning in that maybe didn't catch a segment last year, let's
Yeah.
enlighten them and tell them what's going on.
Sure. So open enrollment started November 1st. It's for individual health insurance. So if you have a plan through your employer, this means nothing to you. So it's for those who have plans through the marketplace. Some people can get plans direct through the carrier. It's from November 1st through December 15th. It's an opportunity to make changes to your existing plans, enroll in a new plan. I guess that's about it.
Okay. And, there's been some changes.
Yes.
There's been a lot of media, if you will, an executive order. Let's talk about that.
Yeah.
What's cooking?
So kind of a big deal. I mean, there's changes every year. It's kind of expected. Certainly, one thing I recommend to people, if you haven't if you haven't looked into your options, you need to sit down with somebody and actually look at them, or get on the computer yourself and take a look and see what's out there. Every year, your subsidy, if you qualify for assistance, that does increase. So I definitely recommend that you run the numbers again. Your subsidy is based off of household income, so adjusted gross income, and the number of people in your household.
Okay.
The tricky thing about it is it's a estimated number, so it's actually based off of 2018 income. But back to your original question, this executive order, that's sort of the big deal. So with this whole Affordable Care Act, each year we're seeing increases to the rates. So one of the things they're trying to do, or one of the things they have done, is now they've made it group employers or employer plans can now, cross state lines. So it becomes more competitive. There's more carriers, more options for group plans. The individual side, what they've done is temporary plans. A lot of people have looked into temporary policies to offset the premium increase. Temporary policy normally is on a 30-day or 90-day policy period. They've now increased that to a 12-month policy period.
Oh, that's fantastic. And let's dig in a little bit, Kelly, about the number of insurance providers, I guess, or because there was a big change or lack thereof from year over year.
Yes. So for those who do qualify for the individual policy plans or policies, there's 3 carriers that are remaining: Blue Cross Blue Shield,
Okay.
Ambetter, and Cigna. Cigna is only offering HMO plans. I'm sorry, there's 4, and Health Alliance. So Cigna, only HMO. Ambetter, also only HMO. Blue Cross Blue Shield will offer an HMO and a PPO plan, and then Health Alliance will offer an HMO and a POS plan.
Okay. And when you think about, first of all, there's so many decisions, but an HMO versus PPO, can you elaborate a little bit about that?
So HMO plan, really the big difference between the two is referrals. So on an HMO plan, you'll have a primary care physician. You'll have to do all of your healthcare needs through that primary care physician. So if you want to see a specialist, you need to be referred by your primary care physician. On a PPO plan, you call anyone.
Kind of open.
Yeah, and you could go to the doctor. Now, I recommend to make sure the doctor's in the network for preferred pricing, but you can choose to go to a doctor that's out of network. You just pay a little bit more to see that doctor.
Okay. Yeah, I mean, because it's first of all, a lot of decisions and a lot of pre-work, if you will. What about increases in policies? I mean, what were the percentages? I know that they went up significantly last year when we talked.
Right.
What's it looking like now for 2018?
So it, of course, depends on the plan, but it looks like it's anywhere from a 15 to a 30% rate increase.
Okay. So, yeah.
So that brings back that temporary policy. So a lot more people last year were looking into temporary plans because the premium is half.
Right.
So it's a lot less.
Oh my gosh. Yeah, that's huge consideration. Is there anything that they can do are there options to avoid the increase?
Sure. First thing I always recommend is sit down and actually calculate your adjusted gross income for 2018. A lot of people don't even realize that they qualify for the assistance. So if you qualify for the assistance, take it. Part 2 to that, I would say, is consider a temporary policy. If you don't qualify for the assistance, I would check out the rates for a temporary plan. It's the same as a permanent policy in that everything's covered. The difference on a temporary plan is there's no pre-existing conditions, so they will not cover you if you have a pre-existing condition. They do not cover for preventative services, so you'll pay 100%, but it goes towards your deductible. Outside of that, it's a PPO network. Option 3, I would say, take a look at your whole picture. So I'm a broker, which means I represent multiple carriers and I sell multiple products. So I would say sit down with your broker, have them take a look at your auto and home insurance, and have them take a look at the full picture. I sometimes save people $1,000 a year on their home and auto insurance. That'll help offset your health insurance premium. That's
a great tip. So really an insurance checkup.
Right.
Is something that is necessary. So, we talked a little bit about opting out of self-insurance, and, Can you talk a little bit about penalties when, for instance, if you don't get into the plan, by the due date, what is that looking like for
Sure.
2018?
So for 2018, the penalty is $695 per person.
Okay.
And half for children. That is prorated. So
Okay.
if for some reason you don't, if it's only half the year, they're only going to calculate that for half the year.
Okay. How does that compare to last year, Kel?
It's the same.
It is.
Although I
okay.
will have mentioned it is 2.5% of your income, whichever is higher.
Ah.
So if
okay.
you do have a higher,
If someone has a bump from year over year, then that could be a higher fine or fee, if you will.
exactly.
Okay, let's talk a little bit about your plans for the future. I know this is the busiest time, or one of the busiest times for you, and what's going on in the business?
Sure. I mean, right now it's survival mode. I'm just trying to do as many appointments as I can per day and just keep myself available via email or phone. And after open enrollment ends, it's all about gearing up for next year.
Have they ever talked about expanding that period? Because it does seem like there's so many consumers out there, and there's, like individuals yourself, that's a lot of work to get in a short period of time. And then also for consumers that are doing their homework, so to speak, they might need some time to really investigate that and,
Sure.
and zero in. Has there been any?
So funny that you ask about extending it, because they've actually shortened it this year.
Yeah, I noticed.
So it normally would go to January 31st. This year it's only till December 15th. Inevitably, what happens every year is that date does get bumped back by a couple days. Do not plan on that happening. I mean, plan on that deadline
right.
being December 15th.
Get in now.
Right.
Get in now. Well, it's always a pleasure to have you on the show and give us the up-to-date on what's happening in the insurance world. As far as plans for the future, you just get your updates and keep your clientele updated as well. How long does it typically take for you to assist your customer?
I mean, we could do it pretty quickly. All enrollment can be done online. So,
Okay.
I mean, as long
Good
as
to know.
we can do it as fast as 15 minutes, but you have to.
You have to have your choices made.
You have to know everything that you want to do. But I mean, I always sit down and I take a look at the network. I want to make sure if you have doctors or hospitals that you have to keep in the network, I always like to make sure that they're in the network. So, I mean, doing that, it probably takes me a half hour to an hour.
Okay. Well, Kel, we're already short of time here. It was so great to have you on. If you have a parting message for our viewers, we wish you the best through this season and a prosperous 2018.
Thank you. I guess my parting message would be, don't be afraid to contact an agent for your help on your health insurance needs. I mean, a lot of people assume that we charge a fee for that. We're actually paid by the carrier. So contact your local agent.
Thanks, Kelly. To find out more about Kelly Burke Insurance, you can reach the Chamber office at tinleychamber.org.